Hemorrhoids, also known as piles, are swollen veins in the lower rectum and anus that can cause discomfort, pain, and itching. Making certain lifestyle changes can help manage and prevent hemorrhoids. Here are some down below. Number 1. Avoid prolonged standing. Avoiding prolonged sitting or standing is an important aspect of hemorrhoid prevention and management. Here are some additional points to consider when it comes to the relationship between prolonged sitting or standing and hemorrhoids. Reduced pressure on the rectal area. Prolonged sitting or standing can increase pressure on the rectal veins, which can contribute to the development or worsening of hemorrhoids. When you sit for extended periods, especially on hard surfaces, the pressure on the rectal area increases, potentially causing blood to pool and the veins to become swollen. Similarly, prolonged standing can lead to increased pressure on the veins in the lower body. By avoiding excessive sitting or standing, you can help alleviate the pressure on the rectal area and minimize the risk of hemorrhoids. Improved blood circulation. Both prolonged sitting and standing can impede proper blood circulation, which can contribute to hemorrhoid formation. Sitting for long periods can compress blood vessels and hinder blood flow to the rectal area, while standing for extended periods can result in blood pooling in the lower body. By avoiding excessive sitting or standing, you can promote better blood circulation, ensuring an adequate supply of oxygen and nutrients to the rectal tissues and reducing the risk of hemorrhoids. Prevention of straining. Prolonged sitting or standing can sometimes lead to prolonged periods without moving or changing positions, which may contribute to constipation and straining during bowel movements. Straining increases the pressure on the rectal veins and can exacerbate existing hemorrhoids or lead to the development of new ones. By avoiding prolonged sitting or standing and incorporating movement into your routine, you can help maintain healthy bowel movements, prevent constipation, and minimize the need for straining. Engagement of muscles and exercise. Prolonged sitting or standing can lead to muscle inactivity, particularly in the lower body and pelvic area. Inactivity can weaken the muscles that support healthy blood flow and contribute to venous issues, including hemorrhoids. By avoiding prolonged periods of sitting or standing, you can encourage muscle engagement and promote regular movement. Engaging in physical activity, such as walking or stretching, can help stimulate blood circulation, strengthen the muscles, and reduce the risk of hemorrhoids. Posture and body alignment. Prolonged sitting or standing in incorrect postures can put additional strain on the rectal area and contribute to hemorrhoids. Slouching or sitting with poor posture can increase pressure on the rectal veins, while standing with improper alignment can negatively affect blood flow. By maintaining good posture and body alignment and taking breaks to stretch or change positions, you can reduce the strain on the rectal area and promote better vein health. Number 2. Avoid heavy lifting. Avoiding heavy lifting is an important aspect of hemorrhoid prevention and management. Here are some additional points to consider when it comes to the relationship between heavy lifting and hemorrhoids. Reduced strain on the rectal area. Heavy lifting can put significant strain on the rectal area and increase the pressure on the rectal veins. This increased pressure can lead to the development or exacerbation of hemorrhoids. When you lift heavy objects, particularly if you do so with improper technique or while holding your breath, the abdominal muscles contract, and pressure within the abdomen rises. This increased intra-abdominal pressure can put undue stress on the veins in the rectal area. By avoiding heavy lifting, you can minimize the strain on the rectal area and reduce the risk of hemorrhoids. Prevention of straining. Heavy lifting often involves exerting force and bearing down, which can lead to straining during bowel movements. Straining can cause increased pressure on the rectal veins and contribute to hemorrhoid development. By avoiding heavy lifting, you can reduce the likelihood of straining and minimize the risk of hemorrhoids. Reduced risk of injury. Heavy lifting carries the risk of injuries, such as muscle strains, hernias, and tears in the rectal area. These injuries can further exacerbate existing hemorrhoids or increase the susceptibility to developing new ones. By avoiding heavy lifting or using proper lifting techniques, you can reduce the risk of injuries and potential complications related to hemorrhoids. Number 3. Wear loose-fitting clothes. Wearing loose-fitting clothes can contribute to hemorrhoid prevention and management. Here are some additional points to consider when it comes to the relationship between wearing loose-fitting clothes and hemorrhoids. Reduced friction and irritation. Tight or restrictive clothing can create friction and irritation in the anal area, which can exacerbate existing hemorrhoids or contribute to their development. Clothing such as tight jeans, Underwear with tight elastic bands, or synthetic materials that don't allow for proper airflow can trap moisture and heat, leading to increased irritation. By opting for loose-fitting clothes, you can minimize friction and irritation in the anal area, promoting comfort and reducing the risk of aggravating hemorrhoid symptoms. Improved air circulation. Loose-fitting clothes allow for better air circulation around the anal area, which helps keep the area cool and dry. Adequate airflow can prevent moisture buildup, reduce the risk of bacterial or fungal infections, and promote proper healing of existing hemorrhoids. Choosing breathable fabrics such as cotton or moisture-wicking materials can further enhance air circulation and help maintain optimal hygiene in the anal area. Enhanced comfort and reduced pressure. Tight clothing, especially around the waist and abdomen, can increase pressure on the rectal veins and contribute to hemorrhoid formation or exacerbation. Loose-fitting clothes, on the other hand, provide more room and reduce the pressure on the anal and rectal area. This can help alleviate discomfort, minimize the risk of blood pooling in the veins, and support better overall vein health. Prevention of restrictive movement. Tight clothing can restrict natural body movements, potentially leading to discomfort and strain in the rectal area. For example, wearing tight pants or skirts can limit leg movements and increase pressure on the pelvic area. By opting for loose-fitting clothes, you allow for unrestricted movement, reducing strain on the rectal area and minimizing the risk of hemorrhoid-related complications. Encouragement of good hygiene practices. Loose-fitting clothes can facilitate proper hygiene practices in the anal area. Tight clothing may make it more challenging to clean the area effectively after bowel movements, potentially leaving residue or irritating the skin. Wearing loose-fitting clothes allows for easier access and thorough cleansing, promoting good hygiene and reducing the risk of infections or further irritation. Psychological comfort. Wearing loose-fitting clothes can also provide psychological comfort for individuals dealing with hemorrhoids. Tight or constricting clothing can draw attention to the affected area and increase self-consciousness or discomfort. By wearing loose-fitting clothes, individuals can feel more at ease and less conscious of their condition, contributing to improved overall well-being. Remember that while wearing loose-fitting clothes can be beneficial for hemorrhoid prevention and management, it's important to find a balance between loose and overly baggy garments. Extremely loose clothes may cause friction or bunching, which can also lead to discomfort. Aim for clothing that allows for comfortable movement, proper airflow, and minimal pressure on the rectal area. By opting for loose-fitting clothes, you can reduce friction and irritation, improve air circulation, enhance comfort, minimize pressure on the rectal area, encourage good hygiene practices, and promote overall well-being while reducing the risk of hemorrhoids and related complications. If you've enjoyed this video and helped you learn more about gout, please be sure to subscribe to our channel and click the notification bell so that each week we release a brand new, life-saving video, you'll get notified right away.